Okay, let's dive in. Having a dog brings so much joy, truly. But it also means being ready for, well, the unexpected stuff. Accidents, sudden illnesses.
Yeah.
They happen.
They absolutely do. And those first few minutes between when something happens and when you get to the vet, they can be, honestly, make or break.
That's exactly what we're tackling today. We're doing a deep dive into canine emergency first aid, drawing from, solid veterinary sources.
Yeah, we're not trying to turn anyone into a vet overnight. That's not the goal. This is about knowing how to stabilize your dog, maybe lessen the injury severity, and critically, buy that precious time.
It's about being that prepared pet parent, right? So our mission today is to cover the essentials wound care, recognizing scary things like poisoning or seizures, even CPR. We want you to feel equipped to act decisively when, frankly, every second counts.
But before we even touch on techniques, the absolute first step, always, in any emergency, you have to try and stay calm. Easier said than done, I know.
Oh, definitely.
But panic doesn't help. And right alongside staying calm, immediately call your vet or the nearest emergency animal hospital. Get professional advice rolling right away.
Being decisive comes from being prepared beforehand. So let's talk contacts. You need these numbers before you're panicking.
Exactly, your regular vet's number, obviously, but also know where your closest 24-hour emergency vet is and have their number saved. And critically, the poison helplines.
Yes, the poison lines. Super important.
Essential. There are two main ones the sources always highlight for 24/7. Help with potential toxin ingestion. You should seriously put these in your phone right now.
Okay, what are they?
First is the ASPCA Animal Poison Control Center. That number is 888-426-4435.
888-426-4435.
Got it. And the second is the Pet Poison Helpline at 855-764-7661.
855-764-7661.
Okay. Now, there's usually a consultation fee for these calls, but honestly, the specialized advice you get instantly tailored to the substance and your dog's size, it's invaluable. It can save you a frantic, expensive ER trip sometimes.
All right, just to find out it wasn't actually dangerous. So, know the numbers, call first. That's our starting point. Okay, so we've made the call, maybe help is on the way, or we're prepping for transport. What's the immediate next thought in that emergency situation?
Safety. Your safety first and foremost. Because even the sweetest, most gentle dog can bite when they're in severe pain or really scared.
It's not personal, right? It's instinct.
Exactly. It's a neurological response to fear and pain. So protecting yourself allows you to actually help them. And often that means considering a temporary muzzle.
Muzzling. Okay. Seems straightforward, but there are some huge warnings attached to that.
Absolutely critical warnings. You never muzzle a dog that's overheating. They need to pant to cool down. A muzzle stops that completely.
That makes sense. What else?
Also, never muzzle if they're having any trouble breathing, any respiratory distress at all, or if they seem like they might vomit.
Oh yeah, vomiting with a muzzle on sounds like a disaster. Choking hazard.
A huge one. It could block their airway. So those situations are absolute no-goes for muzzling, life or death exceptions.
So assuming none of those apply, and we need a muzzle quickly but don't have a proper one, how do we improvise?
Good question. You can use everyday things. A roll of gauze bandage is perfect, but a scarf, a necktie, even a leash in a pinch.
Okay, how does that work?
You make a large loop in the middle. Then, ideally from behind the dog so you're safer, you slip the loop over their snout, fairly high up.
Over the nose.
Right over the snout, yeah. Quickly tighten it so the mouth is held closed. Then, you tie a single, simple knot on top of the nose.
Okay, not on top.
Then, cross the ends under the chin, bring them back behind the ears, and tie them securely, but, and this is important, use a slip knot or a bow.
Why a bow? Seems less secure.
It's about quick release. If the dog suddenly gags or needs to vomit, you need to get that muzzle off instantly. A bow lets you do that. Keep scissors handy in your kit too, just in case you need to cut it off fast.
Right, quick release is key. Okay, dog is restrained if needed. Now, moving them. Especially if we suspect something serious, like a back injury or internal bleeding. How do we transport safely?
Depends on the size. For little dogs, their carrier is often best. But here's a pro tip. Don't try and shove an injured, scared small dog through that little front door.
Yeah, that sounds stressful.
Take the top off the carrier if it's the type that splits. Then you can gently lower them in without bending or twisting them much. A sturdy cardboard box can work too for very small pets.
And for the big guys, if they've taken a fall or been hit by a car.
You need rigidity. Don't just try to lift them in a blanket if you suspect broken bones or spinal issues. You need a makeshift stretcher.
Like what, a piece of wood?
Exactly. A solid board, piece of plywood, maybe even a large plastic sled if you have one. The technique is to gently slide a blanket or coat under them first, then use the blanket to carefully slide or lift them onto the rigid board. Minimum movement is the goal.
Okay, safety, restraint, transport. Makes sense. But our ability to do anything useful hinges on having the right stuff. Let's talk first aid kits. What are the must-haves?
A good kit saves time when time is critical. For wound care, you absolutely need sterile gauze pads, the square ones. But even more important, non-stick pads.
Non-stick, like Telfa pads.
Exactly. Telfa pads are the common brand name. Regular gauze can stick horribly to a wound, and pulling it off later, it rips away healing tissue. Telfa prevents that.
Good tip. What about wrapping materials?
You need rolled gauze, this is for the padding and initial layer, and then you need a self-adhesive bandage roll. Things like vet wrap, Coban, or even athletic wrap.
The stretchy stuff that sticks to itself.
Yeah, sticks to itself, but not the fur, which is great. You'll also want some regular adhesive tape, the terrible kind, to secure the ends of the wrap sometimes.
And for cleaning.
Keep it simple. Mild liquid soap, access to clean, warm water. For disinfectants, the pros recommend having either chlorhexidine solution or scrub, or betadine, which is povidone iodine. They're effective but generally gentle.
Okay. Antibiotic ointment?
Definitely. Not just for fighting infection, but a thin layer on that non-stick Telfa pad helps even more to prevent sticking and keeps the wound environment healthy. And finally, blunt-tipped scissors. Essential for cutting bandages, and like we said, for quickly cutting off that makeshift muzzle if you need to.
All right, let's tackle external injuries. Bleeding is usually the scariest thing to see, but often it's something we can actually manage initially. Unlike, say, hidden internal bleeding. Basic hemorrhage, control what's step one.
Direct pressure, no question. Grab a compressed sterile gauze is ideal, but a clean washcloth, even a sanitary napkin works wonders because they're super absorbent.
A sanitary napkin, interesting.
Yeah, seriously, apply it directly to the wound and push down firmly. Constant pressure.
Now, here's a point the sources really emphasize, and it's different from what we might think. If that pad gets totally soaked with blood, what do we do? Or rather, what don't we do?
You absolutely did not remove the soaked pad. It feels counterintuitive, right? You want to put a fresh one on.
Yeah, exactly.
But pulling off that soaked pad rips away the tiny blood clot that's just starting to form underneath. That clot is what stops the bleeding. If you remove it, you're back to square one, or worse.
So what's the rule then?
Simple. If it soaks through, you just slap another clean pad right on top of the first one, keep layering, and keep applying pressure. Don't peek. Don't remove, just add and press until you get to the vet, or the bleeding slows significantly.
Add, don't subtract.
Got it.
Okay, let's say the bleeding is under control. Now we need to clean the wound.
Right. First, gently flush it with warm water if you can. Get any obvious dirt or debris out. If it looks contaminated, you can use a very mild soap or, ideally, a diluted bit of that chlorhexidine or betadine we mentioned.
Gently does it.
Very gently. Then, and this is crucial, pat it dry. Carefully. With sterile gauze or a clean cloth. Trapping moisture under a bandage is asking for infection. Needs to be clean and dry.
Okay, clean and dry. Let's get practical. Paw injuries are super common. Cut pads, torn nails. Assuming it's not a catastrophic injury, how do we wrap a paw correctly?
First, quick assessment. Is it pouring blood uncontrollably? Does the toe look broken or dangling at a weird angle? If yes, forget wrapping. Just apply pressure and go straight to the vet.
Okay, but for minor cuts or scrapes.
Clean it, dry it thoroughly, then take your non-stick Telfa pad, maybe put a little smear of antibiotic ointment on it first.
To prevent sticking.
Exactly, and for the antibacterial effect, place that directly over the wound.
Pad on. What's next?
The rolled gauze. Start wrapping gently from the toes up the leg a bit. You want to overlap each layer by about half 50% overlap.
Why do you overlap?
It ensures even pressure and stability. Do this maybe twice around, creating a nice padded layer. This absorbs any further ooze and provides cushion.
Okay, 2 layers of rolled gauze, then the sticky stuff.
Then the vet wrap or Coban. You wrap this the same way, overlapping by half. But here is the absolute golden rule of bandaging.
Don't pull it too tight.
Do not pull it too tight. This stuff is elastic. It's incredibly easy to stretch it as you wrap, and if you do, it constricts like a tourniquet once you let go. You can cut off circulation completely, wrap it smoothly, snugly, but without stretching it tight.
Huge caution there. How do we finish it off?
Usually it sticks to itself. If the end isn't secure, just use a small piece of that adhesive tape. Now, post-wrap care is just as important.
Monitoring it, yeah.
Yes. If possible, try to leave the tips of the two middle toenails visible.
Why those two?
They act like your little warning system. Check them regularly. Are they swelling up? Are they turning bluish or pale? Do they feel cold compared to the other paw?
Uh-oh. Bad sign.
Very bad signs. Means the bandage is too tight, circulation is cut off. If you see any of that, take the bandage off immediately and rewrap it much looser.
Okay, check the toes. What about the top edge of the bandage?
You should be able to comfortably slip one or maybe two fingers under the top edge of the bandage. If you can't wedge a finger in there, it's too tight up top.
Good checks. What else?
Keep it dry. Absolutely critical. Put a plastic bag or a dog booty over it for potty breaks outside, but take the plastic off immediately when you come back inside. Trapped moisture causes nasty skin infections and sores.
And stopping the dog from messing with it, the licking and chewing.
Ugh, yes, the cone of shame. An Elizabethan collar is often necessary. Licking introduces bacteria. Chewing? They could actually ingest bandage material, which can cause a bowel obstruction, another emergency. Sometimes bandage deterrent sprays work too.
Then check the wound itself when you change it.
Every time. Change it every day or two, or sooner if it gets wet or dirty. Look for increased redness, swelling, any yellow or white discharge, or a bad smell. Take pictures daily to show your vet. It helps them track progress.
Okay, good rundown on general wrapping. What about specific bleeding nightmares, like broken nails? They bleed so much.
They do. It's because the quick inside has a blood vessel and nerve. If you have it, a styptic pencil, silver nitrate stick, or styptic powder works fastest. Just press it onto the bleeding nail tip.
And if we don't have those fancy vet things,
Okay.
chin remedies.
Yep, the sources suggest some common household items. You can try packing cornstarch, baking powder, or even regular flour onto the nail tip. Apply pressure over it.
Flour, really?
Yeah, it helps absorb and clot. Another old trick is to firmly press the bleeding nail tip into a bar of soap. The soap physically plugs the vessel.
Huh. Bar of soap. Good to know. Okay, the other big bleeder. Ear flaps. Ear cuts look horrific.
They do. Lots of blood vessels near the surface, and every time they shake their head, splat, it reopens.
So how do we manage that?
It's mostly about immobilizing the ear. Put gauze pads on both sides of the cut on the ear flap. Then gently fold the whole ear flap up over the top of the dog's head, flat against their skull.
Okay, ear folded over the head.
Then use bandage tape or vet wrap to secure it. Wrap it around the head, over the folded ear, under the chin neck, and back around, like a head bandage holding the ear in place.
Seems tricky.
It can be. The key is, again, not too tight around the neck. Make sure you can easily fit 2 fingers underneath the wrap where it goes under the neck. You don't want to impede breathing or swallowing. This basically uses the dog's head as a splint for the ear.
Okay, shifting gears now to some really scary internal stuff. Let's start with poisoning. It's terrifying because it can happen so fast and the signs can be so varied.
Absolutely. And recognizing those signs quickly is paramount. Symptoms really depend on the poison, of course, but there are some common red flags.
Like, what should we be looking for?
Things like sudden excessive drooling or foaming at the mouth, maybe really dilated pupils, vomiting and diarrhea are common, obviously. Tremors, muscle twitching, or even full-blown seizures.
So neurological signs too.
Definitely. Or they could go the other way. Sudden severe lethargy, weakness, collapse, signs of shock. Sometimes if it's something corrosive, you might see burns or ulcers on their lips or in their mouth.
The sources really hammered home that one of the most frequent and dangerous sources of poisoning is us, our medications. The nightstand danger.
Oh, absolutely. It's so easy to drop a pill or leave a bottle open. Let's break down the big offenders because this is critical. First up, NSAIDs.
Non-steroidal anti-inflammatories
Yeah.
like ibuprofen, naproxen, aspirin.
Exactly. Advil, Aleve, aspirin. These are incredibly dangerous for dogs. The danger is, well, it's multifaceted.
How do they cause damage?
Okay, so NSAIDs work by blocking chemicals called prostaglandins. In humans, that reduces pain and inflammation. But prostaglandins also protect the stomach lining and maintain blood flow to the kidneys.
So in dogs.
Blocking those prostaglandins strips away the stomach's protection, leading to severe ulcers and bleeding, sometimes very rapidly, and it can shut down blood flow to the kidneys, causing acute kidney failure. Plus, they get absorbed really fast, peak danger within hours.
Scary.
Yeah.
Okay, next on the hit list, acetaminophen, Tylenol.
Tylenol is another huge crisis, especially toxic to cats, but very bad for dogs too. It causes severe liver damage, liver failure. Basically, it wipes out a crucial antioxidant the liver needs.
What are the signs for Tylenol toxicity?
Often lethargy, maybe vomiting, difficulty breathing. Sometimes you see swelling of the face and paws. Again, even 1 or 2 pills can be catastrophic depending on the dog's size.
Right. Then there are the more potent human meds, like ADHD medications.
Yeah, things containing amphetamines, Ritalin, Adderall, these are powerful stimulants. In a dog, they can cause life-threatening tremors, seizures, dangerously high body temperature hyperthermia, which leads to organ damage, heart problems, respiratory arrest. Very bad.
And things like blood pressure pills or sleep aids.
Also very risky. Blood pressure meds like ACE inhibitors or beta blockers can cause a dog's blood pressure to plummet dangerously low. They might get really weak, stumble, collapse.
And sleeping pills, and Xanax, Ambien.
They can cause extreme lethargy, disorientation, dangerously slowed breathing, or, weirdly, in some dogs, they cause the opposite, severe agitation and hyperactivity. The bottom line is no human medication is safe for a dog unless prescribed by a vet, period.
Okay, message received on human meds. What about common household stuff and foods? Quick recap.
Antifreeze is a classic, sadly. It tastes sweet, but causes irreversible kidney failure very quickly. Rat poisons are insidious. They often cause internal bleeding days after ingestion. Pesticides, cleaning supplies, all dangerous.
And foods, beyond the well-known chocolate and grapes raisins.
The big one to constantly remind people about is xylitol, that artificial sweetener in sugar-free gum, some peanut butters, baked goods.
Why is xylitol so bad?
In dogs, it triggers a massive sudden release of insulin. This causes their blood sugar to crash dangerously low, leading to seizures, collapse, and it can also cause acute liver failure. It's incredibly potent in dogs.
Wow. Okay, what else?
Onions and garlic are toxic, especially in concentrated forms like powders, avocado, macadamia nuts, anything with caffeine. And a weird one, raw bread dough.
Raw dough.
Yeah, the yeast ferments in the warm, moist environment of the stomach. It produces alcohol, leading to alcohol poisoning, and the dough expands, causing potentially life-threatening bloat. Even things like homemade Play-Doh can be risky if they contain a lot of salt or cream of tartar.
Good grief. So if we suspect poisoning, what's the immediate action plan?
First call is to your vet or one of those poison control numbers we gave out earlier immediately. Don't wait.
Have info ready.
Yes. Know the product name if possible, any ingredients listed, how much you think they ate, and when it happened. Also, know your dog's approximate weight. And the critical rule, the one everyone needs to remember.
Don't make them vomit.
Do not induce vomiting unless a vet or poison control specifically tells you to.
Why not? Seems like the logical first step.
Because if they swallowed something caustic, like bleach or a battery, vomiting brings that substance back up, causing a second burn to the esophagus and mouth. Horrible. Also, if the dog is already sleepy, weak, or having neurological signs, making them vomit could cause them to inhale the vomit into their lungs, aspiration pneumonia. Very dangerous.
Okay, so only induce vomiting if instructed. If they do tell us to, what do we use?
The only recommended substance is standard 3% hydrogen peroxide, not the concentrated stuff for hair, just regular household peroxide.
And the dose?
It's 1 teaspoon per 10 pounds of body weight. You can give it once, wait 15-20 minutes, and if nothing happens and you're still instructed to try, you can give a second dose. But that's usually the max.
And definitely no syrup of ipecac.
Absolutely not. The sources are clear. It's not reliable in dogs and can actually be toxic itself. Stick to peroxide and only if told to.
What if it's not something they ate, like they inhaled fumes or got something on their skin?
If they inhaled something toxic smoke, chemical fumes get them into fresh air immediately. Call the vet. If they got a powder or chemical on their fur or skin, call the vet first for instructions.
Don't just wash it off.
Not necessarily. If it's a dry powder, try to gently brush or vacuum it off first without getting it wet. Some chemicals react with water and become worse. If it's a liquid or the vet says to wash, use lots of lukewarm water and maybe a very mild soap. And wear gloves yourself.
Good point. Okay, let's pivot to another really frightening event. Seizures. That sudden electrical storm in the brain.
Yeah, seizures, convulsions, fits, whatever you call them, they're scary to witness. They can have many underlying causes.
Like what?
Head trauma, poisoning like we just discussed, metabolic issues like low blood sugar, liver, or kidney disease, sometimes stroke. But often, if they're recurrent, the cause is epilepsy.
Epilepsy, that's a brain disorder itself, right?
Yes, a neurological condition. Vets usually diagnose epilepsy after a dog has had at least 2 seizures that weren't provoked by any identifiable cause and occurred more than 24 hours apart.
Are there things that can trigger a seizure in a dog prone to them?
Definitely. Stress is a big one. Travel, loud noises like thunderstorms or fireworks, even vet visits. Some owners report specific foods or medications as triggers. Keeping a detailed seizure log, what happened before, during, and after, is incredibly helpful for your vet.
Okay, the seizure starts. What do we do right in that moment?
Your job is protection and observation. First, quickly move any furniture or hard objects away from the dog so they don't injure themselves thrashing.
Clear the area.
Yes. Second, try to dim the lights and keep things quiet. Loud noises or touching them unnecessarily can sometimes prolong the seizure. Just let it run its course while keeping them safe from injury.
And the absolute critical safety rule for us.
Never put your hands near or in the dog's mouth during a seizure. They aren't going to swallow their tongue, that's a myth, but their jaw muscles clamp down uncontrollably. You can get a very severe bite injury. Just stay clear of the mouth.
Okay, don't touch the mouth. What else?
Make a mental note, or even better, time it. Note exactly when it started and how long it lasts. Observe what happens, paddling limbs, drooling, loss of bladder control. This is all crucial info for the vet.
Most seizures stop on their own pretty quickly, right?
Yeah, usually within 2 or 3 minutes. But here's the emergency threshold. If a seizure goes on for longer than 5 minutes.
5 minutes.
Yes, 5 minutes or more. Or if the dog has multiple seizures back to back without fully recovering in between, that's called cluster seizures.
Yeah.
Both of those situations are immediate, life-threatening emergencies.
Why is longer than 5 minutes so critical?
Because during a prolonged seizure, the dog's body temperature can skyrocket to dangerous levels and their brain isn't getting enough oxygen. This can cause permanent brain damage or even death. So 5+ minutes or clusters, rush to the emergency vet immediately.
And after it stops, assuming it was short.
They'll likely be disoriented, maybe a bit wobbly or sleepy. This post-ictal phase can last up to a couple of hours. Just keep them calm, quiet, maybe offer some water once they seem aware, and let them rest and recover. And always call your vet afterwards to report it, even if it was short.
Okay, moving into perhaps the most critical systemic issue.
Yeah.
Shock. This isn't just being startled, it's a body-wide crisis, right?
It's a profound physiological collapse. Shock happens when the body's tissues aren't getting enough oxygenated blood. It's the downstream effect of severe trauma, major bleeding, heart failure, even severe allergic reactions or heat stroke.
What's actually happening inside the body?
The body tries desperately to compensate. Blood pressure starts to fall, so the heart beats faster to try and keep up. The body then starts shunting blood away from the less essential areas like the skin, paws, and gut, trying to preserve flow to the vital organs, the brain, heart, kidneys.
So how do we, as owners, spot this happening? What are the vital signs we need to check?
Okay, first, feel for their pulse. The best place is the femoral artery, high up on the inside of the thigh in the groin area. In early shock, the pulse will feel fast, but weak or thready. Hard to feel strongly.
Fast but weak pulse.
Okay.
What's next?
Look at their gums. Lift their lip. Healthy gums are pink. In shock, because blood is being pulled away from the surface, the gums will look pale pink, or even white or grayish-bluish if it's severe.
Gale gums. That's a big visual cue.
Huge. You can also check capillary refill time, or CRT. Press gently on the gum until it blanches white, then release. The pink color should return almost instantly, in less than 2 seconds. If it takes longer, that's poor circulation, a sign of shock.
Delayed CRT. Okay. What else might we see or feel?
Breathing will likely be rapid and shallow. Heart rate will be high. Feel their ears or paws. They might feel cool or cold to the touch as circulation pulls back. They might shiver or vomit.
And eventually.
As shock progresses and the body can't compensate anymore, they may become very quiet, lethargic, unresponsive, and eventually collapse. Their body temperature will also likely drop below the normal range, which is roughly 100.4 to 103.1 Fahrenheit. A falling temp is a very bad sign.
So if we suspect shock, what can we actually do besides race to the vet?
First aid for shock is all about supporting them during transport. The main thing is to keep them warm. Wrap them in blankets, towels, coats, turn the car heater up. Maintaining body temperature helps circulation.
Keep them warm. And then
You follow the ABCS while heading to the vet. Airway, breathing, cardiac function.
okay, airway. What does that mean practically?
Make sure nothing is blocking their throat saliva, vomit, a foreign object. If they're conscious, be super careful trying to look. They might bite out of fear. If unconscious, gently extend their neck to help open the airway. Check if they are breathing. Watch for chest rise and fall. If they're unconscious and not breathing, you'd start rescue breathing, which we'll cover with CPR.
And cardiac function.
Feel for that pulse again, or try to feel for a heartbeat directly on the chest wall behind the elbow. If there's no pulse or heartbeat and they aren't breathing, that's when you'd initiate CPR. But checking ABCS takes seconds. The priority is getting them moving towards vet care.
Right. Now, linked to shock is often internal trauma, the hidden injuries. These sound incredibly dangerous because you might not see anything wrong initially.
They are arguably the most dangerous because they're invisible. A dog can get hit by a car, seem okay, walk around, and then collapse hours later from internal bleeding.
What are the common types?
A major one is hemoabdomen bleeding into the abdominal cavity, often caused by blunt trauma, rupturing the spleen or lacerating the liver. The belly slowly fills with blood.
Yikes. And chest injuries. Thoracic trauma.
Also really serious. Broken ribs are obvious, but even without fractures, a hard hit to the chest can cause pulmonary contusions, basically bruised lungs.
Bruised lungs. What does that do?
The bruised lung tissue leaks fluid and blood into the air sacs, making it hard for the dog to get oxygen. It's like internal drowning. A worse scenario is hemothorax, where blood fills the chest cavity outside the lungs, physically squeezing them so they can't expand to take a breath.
So how would an owner even guess this is happening? What are the subtle signs?
Look for changes in breathing. Is it faster than normal, more shallow? Does it look like it takes effort? Are they unwilling to lie down, maybe standing with elbows pointed out? That posture often means they're trying to make more room for their lungs to expand.
Any other signs?
Coughing, especially if there's any blood. And again, those signs of shock we just talked about, pale gums, rapid weak pulse, always suggest potential internal bleeding. You could also have things like a ruptured bladder or kidney injury causing abdominal pain, but maybe not immediate pale gums if the bleeding isn't massive right away.
So if there's any suspicion of internal injury, a bad fall, hit by car, sudden unexplained weakness, what's the immediate protocol?
Minimize movement, absolutely. Use that makeshift stretcher if possible. Keep them calm and quiet. Critically, don't give them any food or water.
Why no food or water?
They might need emergency surgery very quickly, and anesthesia is much riskier on a full stomach due to the risk of vomiting and aspiration. So nothing by mouth. And just keep monitoring those vital signs, gums, pulse, breathing effort constantly on the way to the vet.
Okay, this brings us to the most advanced skill. CPR, cardiopulmonary resuscitation. This is really the last resort, isn't it?
It is. You only start CPR if you've determined the dog is unresponsive, they are definitely not breathing, and you cannot feel a pulse or heartbeat. And always, always make sure someone is driving you to the vet while CPR is happening or that transport is immediately on its way. CPR buys time. It doesn't fix the underlying problem.
Got it. So the basic rhythm for dogs is the same as for humans now, right?
Yes. The standard is 30 chest compressions, followed immediately by 2 quick rescue breaths, then right back to 30 compressions, 2 breaths, continuously.
30 to 2. And if there are 2 rescuers?
Ideal scenario. One person does the compressions, the other does the breaths. And you should switch roles every 2 minutes or so, because doing compressions effectively is incredibly tiring.
Makes sense. Let's break down the compressions. How fast?
You're aiming for a rate of 100 to 120 compressions per minute. Pretty fast. The beat of the song Stayin' Alive is actually the right tempo, believe it or not.
Staying alive.
Okay, how do we position ourselves and our hands?
The dog should be lying on its side. Usually the right side down is preferred, but either works. Kneel or stand behind their back. Place the heel of one hand on the chest. We'll talk about exact location in a sec. Put your other hand on top and interlock your fingers.
Both hands together.
Yep. Now lock your elbows. Keep your arms straight and position your shoulders directly over your hands. You want to use your body weight, bending at the waist, to push down, not just arm strength.
Straight arms, bend at the waist. Got it. What about how deep to push? This must vary a lot.
Hugely important, yes. The goal is to compress the chest width by about 1/3 to 1/2.
1/3 to 1/2 the chest width. Right. So for a big dog like a lab or shepherd, that might mean pushing down 2 or even 3 inches. But for a little dog, a Yorkie or Chihuahua, it might only be an inch or even less. You need enough force to squeeze the heart and move blood, but pushing too hard on a small dog can cause devastating internal injuries like broken ribs or lung punctures.
Okay, depth matters. And where on the chest do we push? You said that depends.
It depends on the dog's chest shape. For most medium to large dogs with keel-shaped or deep, narrow chests, think greyhounds, Dobermans, collies, you compress directly over the heart.
There's that exactly.
If you bend their front elbow gently back towards the chest wall, the point where the elbow touches is right over the heart. That's your target for those breeds. It's called the cardiac pump theory. You're directly squeezing the heart.
Okay, deep chests over the heart. What about dogs with rounder barrel chests, like labs, Rottweilers, pit bulls?
For those dogs, you actually compress over the widest part of their rib cage, not necessarily directly over the heart. Lay them on their side, find the broadest point of the chest, and push there. This works on the thoracic pump theory. You're squeezing the whole chest cavity to push blood out.
Widest part for round chests. Interesting. What about tiny dogs and cats?
For the little ones, you generally go back to compressing directly over the heart, but because they're so fragile, you might use a one-handed technique. Place your thumb on one side of the chest over the heart and your fingers on the other side and squeeze the chest between them. Or just use the heel of one hand very carefully.
One-handed for small pets. Good tip. And the really tricky ones, the flat-chested breeds. Bulldogs, pugs.
Yeah, they're awkward. The recommendation is to try laying them on their back if they'll stay that way, and doing compressions directly on their sternum, their breastbone, like human CPR. But if they flop back onto their side, just revert to the round-chested technique and compress on the widest part of the ribs.
Okay, that covers compressions.
Right.
Now, the 2 rescue breaths after the 30 compressions. How do we do that effectively?
First, make sure the airway seems clear. Gently pull the tongue forward if needed. Extend the head and neck so the nose is roughly in line with the spine. This straightens the airway.
Head straight. Then,
Hold the dog's mouth firmly closed with your hand. Then, place your mouth completely over the dog's nostrils, creating a good seal.
over the nose, not the mouth.
Correct. Seal your mouth over their nose. Give a gentle breath, just enough to see their chest rise. Don't overinflate. Watch the chest fall as they exhale passively. Then give the second quick breath. Then immediately back to chest compressions.
Just enough to see the chest rise. And if we needed to do only rescue breathing, say if they had a pulse but weren't breathing.
Then you'd give about 20 breaths per minute, roughly 1 breath every 3 seconds, continuously checking for a pulse.
Okay, one last thing here. What if we think there's an obstruction, like they choked on something and rescue breaths aren't working? Are there other maneuvers?
Yes, a couple of options, but use caution. One is an acupressure technique. Find the nasal philtrum, that vertical groove between the dog's nose and upper lip.
A little crease there?
Exactly. Press firmly on that spot with your fingernail or a dull point for about 10 to 30 seconds. Sometimes this can trigger a gag reflex or a sneeze that dislodges the object.
Interesting. And the Heimlich maneuver, is there a dog version?
There is, but again, be careful, you can cause injury. If the dog is standing, get behind them, wrap your arms around their belly just behind the ribs, make a fist, and give a sharp upward and forward thrust.
Like the human version.
Similar motion. If they're lying on their side, put one hand on their back for support, and use the heel of your other hand to push sharply upward and forward just behind the last rib. For very small dogs, you can even pick them up, holding them with their back against your chest and give a quick compression behind the ribs, or sometimes a careful swing is suggested. But these are definitely last resort measures before getting to the vet.
Wow. Okay, that was incredibly detailed, covering everything from preparation to CPR. Let's try and distill the key takeaways, the core pillars.
Yeah, let's summarize. Pillar 1 seems to be preparation and safety. That's having your kit ready, especially those non-stick pads and vet wrap, knowing those emergency numbers, and understanding how and when to use restraint like a makeshift muzzle safely.
Right. Pillar 2, external control. That's mastering direct pressure for bleeding, remembering to add pads, not remove them, and knowing the steps for a proper paw wrap, plus crucially, how to monitor it for tightness using the toes.
Pillar 3, recognizing the silent threats. Understanding the real danger of common human pills like NSAIDs and Tylenol, and being able to spot the often subtle signs of shock or internal bleeding like pale gums and that rapid, weak pulse.
And finally, Pillar 4, advanced intervention. Knowing when CPR is needed, the 30.2 ratio, and importantly, how compression technique placement and depth changes based on the dog's size and chest shape. Plus, the correct way to give those rescue breaths over the nose.
Absolutely. And underlying all of this is the constant reminder. First aid is stabilizing care. It's not a cure.
Critical point. Anytime you perform these techniques, especially for serious things like seizures, suspected poisoning, shock, major bleeding, or CPR, immediate veterinary follow-up isn't just recommended, it's essential.
Couldn't agree more. We've spent this time focusing on the reactive skills, the hands-on things you do when disaster strikes, which is vital knowledge.
But maybe there's another angle.
Exactly. So here's a final thought for you to consider. We've just covered all these crucial manual skills for emergencies, but what if the most important first aid skill you ever use is actually prevention?
How so?
Think about it. How much emergency care could be avoided by really nailing down preventative commands like a rock-solid "leave it"?
Right.
Or by diligently pet-proofing your home, moving all human medications? especially those common dangerous ones like ibuprofen and Tylenol, way out of reach. Checking your yard for toxic plants.
Yeah.
Could that kind of proactive work actually be the best emergency preparedness of all?
Preventing the crisis before it ever begins. That's a powerful thought to end on. The ultimate goal isn't just to react well, but maybe, ideally, not to have to react at all.
Precisely. Being a prepared pet parent is about both.